Greetings all. Welcome to week six. Week six. 2 more weeks. You're almost there. You're almost there. So know that this week we're going to be focusing on neurocognitive, excuse me, neurocognitive, excuse me. We're going to be focusing on neurocognition and neurodevelopmental disorders. So just as we did during the first week talked about the stigma of mental health, specifically within the military and first responder population. We're going to continue. We're going to pick up and revisit that dialogue and discussion around stigma, with the exception of focusing specifically around the disorders of schizophrenia, dementia, autism, and how many of these diagnoses have been misrepresented in the media and in just common discussion and dialogue among peers and even family members. We're also going to talk about how potentially these particular diagnoses may also, or excuse me, may and often always, I shouldn't say always, may and at times impact our specific populations that we're referring to on the military and first responder side. So specifically, we're going to be identifying the diagnostic criteria for neurocognitive disorders as well as neurodevelopmental disorders. So when we talk about neurocognitive disorders, we're looking at memory, we're looking at changes of behavior, we're looking at difficulty in understanding language, we're looking at trouble performing daily activities as identified in the DSM-5-TR. When we look at neurodevelopmental disorders, we're looking at intellectual disabilities, we're looking at communication disorders, the autism spectrum, and attention deficit hyperactivity disorders. We're also going to be diving into the criteria of schizophrenia, as well as other psychotic disorders within the DSM-5-TR and ICD-10. And then we're going to continue to explore the prevalence of cultural competency and how we as counselors and counselors in training can be culturally responsive when working with our military population and our first responder population. Once again, if you have questions, comments, or concerns, please do not hesitate to reach out, all right? Join me during my office hours virtually, Wednesdays from noon to 1. Give me a call during my office hours. Send me an email for a quicker response. Know that I'm here to support you in your learning. Do take care.